Go up. What? You're supposed to be sleeping. What's going on? You got a haircut? I haven't brushed my hair. Hey, Steven. I think the last time I got one was like 3 weeks ago. Hey, Duke. Duke's having too much fun. What's the matter? I was gonna come and see you guys yesterday, but I couldn't. We lost power, and we actually had a couple of trees fell, so I had to cut them up this morning. Right, Duke? Duke is too relaxed. You wanna say hi? Say hi to everyone. Hey, Al, how are you? Hey, what's going on? Hey, how are you, beautiful dog? Hey, Said. Hey, where are you going? Where are you going? Come on, sit. Order DMSO out of curiosity. Apparently, it's good for everything. Yes, it is excellent, Ashley. Hopefully you'll get it in time. You want some water? Okay, here, come here. Give me a second, guys. Gotta put Duke some water. Wait. You only get a little bit of water at a time. With some magnesium. There you go. Come. You can hydrate yourself. Or maybe I have 8. Hey Mario, what's going on? I maybe missed your first message. Last time I did the gall cleanse, I got bad heartburn and lemon and oil. Is there a different way? No, you have to do it. You will get a little bit of heartburn sometimes because your body's kind of flushing out quite a bit, and sometimes you end up getting too little acidity, and that end up happening. But make sure you're doing at least apples for a couple days so you can actually open up the duct quite a bit. Hey, good evening. How's Duke? Duke is doing good. Zemalic acid for the bile duct. Yes, 100%. That's what we're looking for. There's Duke. Duke is right there. He was sitting on the bed with me. Where are you going, Duke? You're not going outside. It's too dark. Come and stay here. Go sit up on the bed. Hey, go on the bed. Go on the bed. You're not going outside anymore. That's it. No more. Leave my sweater alone. Go. One more thing, for a medium-sized dog, how many drops is it safe for them daily? For what? The magnesium? I give Duke roughly about. I see what happened is when I do his water, I don't actually fill up his water quite too much. Probably like almost less than half a cup every time. And usually I put anywhere between 3 to 5 drops per half a cup, because I don't want him. Because the problem is with a lot of dogs, they actually they overdrink water, and that can actually cause issues or even death, because it could actually cause a toxic issue in their body from water. So I actually put about 3 to 5 drops every time for half a cup of water. And that's all I give him. I give him half a cup. When he's done, I will actually refill it again, but I never give him more than that at a time. Just so he's not overly drinking too much. And he doesn't drink too much water because a lot of his food is raw as well too. Because a lot of the dogs, what happens is when they eat kibbles, it dries them up quite a bit and they end up over drinking too much water, and that actually causes an issue, or sometimes it could cause inflammation in their body. DMSO. Now he's chewing on my shirt, of course. I was taking prednisone for PMR, still having symptoms. Should I go back on the prednisone? It depends how long you were taking it for. Is the over drinking water the toxicity, or is it the trace? It's the toxicity from over drinking too much water. Sometimes they end up getting bloated. And once they get bloated, they can actually have a major, massive inflammation in the brain. Trace minerals, only 5 drops is more than enough to actually hydrate the water. Hey Grace, how are ya? Guys, I do apologize. I haven't been here for almost a couple days, 5 days now. I was trying to come in yesterday, but we actually had a storm and we had a couple of trees get knocked down, so we lost signal and no internet, no power. So we're back up and running as of this morning. So that kind of put me a little bit behind. Been in it since November. Oh, so you've been doing it since November and stuff? Okay. You can't just get off of it instantly. You actually have to wean off correctly. I am great. Thanks for asking. Hello, Maurice. Hope you are well. So far, so good. Iron Vixen. Duke, you're destroying my shirt. Hello, Maurice in chat room. Hey, Latra, how are you? So yeah, we're gonna open up the floor. You guys go ahead if you have anything in specific, because I was gonna actually focus today on a lot of the heart medications, because my new video that I'm gonna actually put out, I'm gonna probably talk about every single heart medication and what supplement we can replacement with what supplement, without any known side effects. You know, from aspirin to Brilinta to statins to a lot of other things that you guys can think of. I'm trying to put them all in the video. I was thinking of launching it tomorrow, but I'll see if I can get it done in time. Hey sir, I'm going to take your advice on using magnesium chloride. Does this form of magnesium absorb best with a meal or empty stomach? Both. With a meal or empty stomach, you're actually gonna get the highest level of elemental, which is roughly about 65%. How much magnesium glycinate recommended for severe anxiety? Anywhere between 200 to 400 milligrams, but you need a steady supply of it every 5 hours, because it doesn't last in the body that long. Hey Dick, what's the matter? You're too relaxed? Are you too relaxed? No, it's raining outside. Hello boss, Abdullah, what's up? How's it going? Fish oil. I bought some resterified triglyceride form to try comments. Fish oil, I bought some resterified form to try comments. What's the brand name? Or is that the brand name? Hello, how much magnesium? The best for extra beat in the heart sometimes when stress. The best for extra beat. You have an extra beat in your heart. That's too much contraction, not enough relaxation. Usually that happens. Like an AFib. Viva Naturals. I'll have to check out the brand. If it's omega-3, if it's actually derived from anchovies or sardines, or is it actually derived from cod liver oil. So there's a difference. Cod liver oil is much more stable. If it's not, then I would stick with DHA only instead of DHA and EPA. Duke, you're destroying my shirt, buddy. Yeah, give it to me. Why are you hiding behind me? I can see you. What are you doing? It's having too much fun. Viva Natural. Since I have my computer with me here, let me see if I can bring it up and I can look at it for you right away. I'm trying to write a new ebook as well too about sleeping, so that would be good. You guys should check it out and download it. Hopefully I'll have it up soon. I don't know when, but it's gonna take me a couple of days. You stay there, bud. You stay there, Duke. You don't have to come here. Let me just turn on my computer so I can look at this brand. Any DHA brand, only recommend. The current one that I take for DHA is actually a Canadian company that actually produces it. I don't know if there's any in the US that actually have it. Duke, relax. I'm not gonna come play with you right now. Hold on. Let's brighten up the screen. It's too dark. So usually if I can get a good cod liver oil, because I used to take cod liver oil and it's been discontinued here for us in Canada. And so the only ones I get right now is just pure DHA. You said it was Viva Naturals Omega-3. Maurice, have you ever messed with vegan? I did, yeah, a long time ago actually. Is it a capsule or liquid for the Viva Naturals you're taking? Or is it only comes in one? So it's 180 soft gels. I started the second of the 3 months of Cavadix, had 100% RCA blockage immediately after getting COVID. For the only time I've had it, hoping the Cavadix will reverse the damage. CAC 374, it should actually help you with that. Connect with me. How long? So you've been on the second, you just started the second of the 3 months. Perfect, on Cavadix. How many you're doing? 1 or 2 a day? Are you following that 4 weeks, 8 weeks, and once every couple days? Yes, I did check for the heart, and the doctor saw 4 extra beat while doing stress EKG. So you're just magnesium deficient. That's why you're actually having the extra beat. So too much contraction, not enough relaxation. What the doctors will try to do, they'll probably put you on a calcium channel blocker. Stop jumping, Duke. Stop jumping. 8 milligrams per day. Okay. So you didn't do the 2 per day. Okay. Yeah, let me know how much percentage you'll actually lose of the calcification, because usually it depends on the calcification score. If it's under 400, we usually start with at least 1 a day, which is good. If you're over 400, we actually do about 2 sessions a day, the 80 grams or up to 12 grams per day. Gel caps, okay. Yeah, let me pull it up here. So it's about 2,500 milligrams per gel pack. Thanks for the information. You are the best. You help a lot. No problem. And you just gotta make sure you're actually you're saturated with magnesium correctly. If you don't saturate with magnesium, you're never gonna fix the issue. And PVCs, S-Creefer, I did do an ebook on heart rhythm, how to actually repair it. Did you actually break my zipper? You broke my zipper? And you're trying to swallow it? Here, give it to me. Where's my little zipper? I actually ripped it apart. Thanks for the information. Planning on getting another CT angio in 2 months. When the treatment is complete, I'll keep you in touch. Yes, please. That would be excellent if you don't mind, and if you have any, before and after, so we can do a comparison would be really good, and we can share it. To lose visceral fat, do I really have to eat less than 20 grams of carbs? This you do, yes, and you do have to do that carb load so you can actually cycle correctly with the glucose levels. That's the only way you can actually penetrate that visceral fat. It's only gonna be, it is gonna be for your own health at the end of the day. Yeah, so there's my little zippers. Actually, it's destroyed. I was trying to swallow it. Intermittent fasting is good. Intermittent fasting is good, yes, for weight loss. If you're looking for longevity process, you should do prolonged fasting. Like we're talking 24, 48, 72 hours. Once or twice a month. If you can do more, would be ideal. Best wishes, Shred Fraser. Of course, we'll share the H. pylori protocol, butyrate. What is the dosage? Thanks. I should the butyric acid. You can actually get it from eating grass-fed butter. Unless you looking to take it into a capsule format. I think they come in 500 milligrams. Estrogen caused my PVC to increase 1,000 a day. What can I do? What do you mean 1,000 a day? 1 meal a day is good? Possibly, if your body can handle it, yes, 100% you could. You just have to consume enough protein and fats. Is ubiquinol good to take? Ubiquinol is probably one of the best form for your coenzyme Q10. And it's highly absorbable compared to the coenzyme Q10 by itself. Is krill oil as good as fish oil or cod liver? Krill oil comes first, cod liver comes second, fish oil comes last. Krill oil is very, very expensive just because it's actually it has a very high absorbable level, but as well it does not oxidize as much. But the problem is you don't get nearly enough. I believe that my mom barely eats. She's almost 95. The whole idea is, whenever we actually longevity and stuff, we get to a point where we don't eat much. Even when, my grandmother was alive, she would only eat 4 ounces of beef liver every day, and that's it. That's all she ate for years. 1 or 2 times a month, 48 or 72-hour fast. That would be ideal. I like to do the 72 hours every 3 weeks. What's the recommended dosage of krill oil? Up to 2,000 milligrams daily would be ideal. If you're doing the cod liver oil, you're looking anywhere between 4 to 5 grams daily. If you're doing the fish oil, then that becomes a little bit of a higher amount. Very high amount sometimes. Would a teaspoon of ghee in the morning contain enough butyric acid to help heal the intestinal mucosal barrier? Possibly. It will actually help because of the butyric acid in it. The problem is, how fast or how soon can it heal it. All depends how long the injury's been. Maurice, what are your thoughts on Parasites and doing a cleanse, ivermectin or other protocols? I'd go for ivermectin or a black walnut, possibly, if you can get your hands on them. But, one of the best things to do is, with ivermectin, is doing a 72-hour fast, if you're worried about parasites or other things in the body. I just did deworming for Duke today, so it's almost very, very similar stuff, If we do it for the pets so often, sometimes, once every 6 months or once every 3 months, because they tend to actually lick things and touch things that they shouldn't. As a human as well, too, we buy stuff from the grocery stores. You know how many hands has exchanged a product, and yet sometimes, we say, okay, we wash it for a minute and we actually end up consuming it. So imagine all these things sometimes going inside your system. So yeah, ivermectin is gonna help, even if taken a little bit. Any protocols for lymphocyte colitis? You'll have to send me a message. I can send you a protocol on it if you like. What is the difference between the vitamin A of sweet potato and carrots? Well, vitamin A and sweet potato and carrots is the same thing, beta carotene. But what we're looking for is the vitamin A that comes from animal products, retinol. That's the proper one that you need. You need roughly about 10,000 IU a day. And usually the vitamin A comes in a liquid form more than anything. I don't know, I always stand, let's sit down, relax. That would be the best thing to do. What animal-based food that have vitamin A? Liver. Liver would have the highest. And should be plenty enough to consume. Are there any new updates on Cavadix? Not yet. Not yet. It's only been about a month and a half, and most of my patients are already. Some are just finishing the first box. Some of them are already started in the second box. So it's just a matter of timing right now. Wait until at least we pass a good 90 days and we can actually test. And I'm hoping, some individuals have done a single enema a day. Some have done 2 enemas a day. So it is gonna vary per person, and hopefully, like, keep in mind, a lot of these guys that they're doing the enema, we're not really looking after. I'm not looking after their diet or any of their changes. Just strictly doing their current diet with the Cavadix. So we'll find out. Once I gather all that information, I'll put a video together with everything, and we can kind of do some comparison and see how much percentage we're able to knock off. Hi Maurice, in your cheat book there is excitotoxin section. We can take any to follow? Yes, 100%. You need at least a combination of 2 out of the cheat book. Yeah, I'm looking forward to it as well too. Keep in mind, I'm doing the Cavadix myself too, but I'm not gonna actually share my full results till I do a full year. I'm doing a full year of Cavadix. So once I head back to the city, I'll book for CCTA if I can get it, or a CAC score, and as well I'll do the difference as well. And hopefully we can get to see, more results of exactly what changes in the body, and the oxidization levels as well too. There is no hearing loss with the Cavadix at all. The current study you're looking at was not done a human study, and I've answered a lot of these questions. I had to actually write an email and send it out to everyone. How to lose muscle? Go on a ketogenic diet. You can lose muscle. What's the best way to lower ApoB? ApoB by itself is irrelevant, Ziggy. You actually have to get your ApoB and your ApoA1, and you have to actually do the division, and we're looking for 0.77 or less. Maurice, my dad takes statins, all other heart and blood pressure medications. What is the best way to get him off of these without going to the short man with the Ehud course? I can get him off the medication with a proper protocol to wean off. The problem is I do have to see some further testing so we can actually do a comparison. But his lifestyle plays a huge role in this. It doesn't mean you can get off medications and not change your lifestyle or maybe add certain supplementation. So we definitely have to look into that, and we'll probably have to discuss it in detail, because the protocol to wean off medications does not happen within a week or two. It can take sometimes anywhere between 16 weeks to 24 weeks, especially when we're talking blood pressure medications. So, does sprinting lose muscle? You know what makes you lose muscle is it's in regards to the intake of food. You know, if you're pretty much, it depends how much protein intake you're actually getting inside your body or not. But yeah, you can burn off your muscle tissue very fast, especially if you are on a low carb and high fat and a very small amount of protein. Your protein is what is essential to preserve your muscle mass. How much red meat to eat every day to build muscle as a male on carnivore diet? I eat 2 pounds a day. So you gotta eat at least 1 gram per 1 pound of body weight. That would be like hands down the minimum you actually have to eat. Hey Pauline, how are you? A lot of my blood pressure medication, lisinopril, a combination of carnivore diet, coenzyme Q10, fish oil, magnesium supplement. I got off my blood pressure medication. That's excellent. 100%. Magnesium is what's going to actually make this happen truly. What do you recommend to control one's appetite? Increase your saturated fats. That will keep you satiated and increase your electrolytes. What is taurine good for? Taurine has a lot of things. I use it mostly to protect your heart. Without taurine, pretty much anybody can have a heart attack. I wish I could eat that much meat again, maybe one day. 1 gram per 1 pound of body weight is plenty enough. You should be able to slowly, gradually, Ziggy, if you could. Boron is good for bones, good for testosterone, good for calcification as well too. It does have a lot of good benefits, but the problem is we don't take much of it. How often do you have to detox the body from parasites? What protocol do you recommend? Once every. I never do it. I have the last time I think I've done it was probably 5, 6, 7 years ago. I don't do it often because I eat a carnivorous diet. So pretty much, think of it this way: when you're actually eating a carnivore diet, you're almost mimicking fasting, and you're not actually allowing anything to ferment in your gut. But if you're a type person that's pretty much eat anything out there, pretty much at least once a year would be ideal. What does it mean if DHA sulfate is high in men? Sometimes they could be estrogen dominant. How to gain weight fast? Caloric intake. Increase your calories. Best, but it depends on the weight you want to gain. It depends how whether you're very skinny or not. What blood test would you recommend for someone with H. pylori? There's actually a blood test they can check and they can actually confirm a positive for H. pylori. That is a standard blood test. It's nothing special. How much taurine to take a day? Could be anywhere from 3,000 to 9,000 milligrams daily. Is intermittent fasting good? Yes, it is good. What helps arthritis in knees or hip? You can use DMSO. as a topical, but as well you can do anything that actually reduces inflammation. But the question is, why are you having arthritis pain? Is it because of the food you're consuming? Do you recommend taking boron 3 to 5 milligrams daily? That's not enough. Sounds good, Joni. Looking forward to it. Ziggy, thanks so much. Yeah, 3 to 5 milligrams a day is not nearly enough. You need at least 32 milligrams of boron. And the only way you can get that much is by taking borax. Is turmeric good? Only if you can get like a good quality turmeric and it has at least 95% extraction or higher, because what we're looking in turmeric is the curcumin effect of it. So the curcumin that we're looking for will need it to be at least a good 95%. There is some companies are producing nano turmeric. I don't know the exact company name. They are out of UK. They did send me a couple samples. It comes in like a liquid form. Thank you for your response. Why taurine? Because taurine preserves the electrolytes for your heart. So if you go look at all the energy drinks, one of their main ingredients in there is taurine, because they know the heavy caffeine and the ephedrine that actually overstimulates the heart. They want to protect the heart from seizing up. So taurine preserves the electrolytes at the cellular level, especially with magnesium for the heart. So prevent the heart from actually seizing up. So every person that actually end up having a heart attack, two things are actually missing from the body: magnesium and taurine. Look for super curcumin by Solgar. There you go. Hopefully you heard that. Hayachi, somebody said look for super curcumin by Solgar. So maybe they might have it on iHerb possibly. Can we take taurine long term? Yes, you could. I've been taking it for many years now. But keep in mind, taurine is one of the best products as well to detox the body. So what held the inflammation? Oxalates. That's why we get arthritis. The nightshade vitamins, nightshade foods, all that stuff causes issues. What helps inflammation? There's a lot of things. There's ginger, there's turmeric, there's resveratrol, there's polyphenols, there's quercetin, vitamin C, vitamin E tocotrienols. There's so many different forms out there that can actually help inflammation and reduce it. Just don't mix taurine with espresso. I haven't tried that. I haven't tried mixing this taurine with espresso actually. Maybe you should look into that. Usually I just take it on an empty stomach. You have to take actually taurine on an empty stomach for it to work, because if it's mixed with other amino acid, it actually conflicts. So there's my taurine. You guys reminded me I gotta take my dose right now. So there you go. This is 3 grams of taurine. Is it 3 grams? Yeah, 3 grams of taurine per scoop. Need some water. I'm gonna put water for Duke. He drank it already. Oh yeah, and there's my magnesium. Couple of drops. I don't know how many drops I just put. 20, 30 drops. What does it taste like? It's tasteless. It's very tasteless. There's no side effect, and it's tasteless. It just dries up your mouth a bit. What kind of taurine I have? This is a Canadian brand. This is a Canadian brand that I get from here. I was buying one from iHerb. I just recently started getting it from here locally. I take anywhere between 3 grams, 3 grams every 4 hours. So roughly anywhere between 9 to 12 grams daily of taurine. How old is Duke? He's 2 years old. He's still a baby. He's a big baby. Why can't NAC be taken every day? You could take it every day. You could if you want to, but I like to actually go a little bit higher on the dosing. So I take 2400 milligrams, 5 days on, 3 days off, see how you feel. If you feel great, then there's no need to take it. If you don't feel great, then you take it again. You like the powder better than you like powder better of the taurine? It should be powder because if it's going to be capsules, it's only 500 milligrams. You'll have to swallow so many capsules. So the powder would be much better to get your full 3000 milligrams per dose. Is it better that taking taurine and magnesium can better maintain magnesium in our cells level? 100%, yes, because taurine will allow the cells to actually utilize magnesium correctly. Should I take NAC with glycine? You should if you want to actually convert it to glutathione correctly. Can I take L-theanine daily? Yeah, you should. There's no issues. I have another one that I take for magnesium. It has all 3 of them. And taurine actually will support your healthy cholesterol levels, allows magnesium to enter the cells correctly. It does work as an anticoagulant. It does support bile production. It does support your neurotransmitter balancing. So taurine, I think it should be 100% utilized by each one of you guys. Seriously, I think it's one of the best supplements out there that's actually so hidden from the public. Do you know why when I consume ashwagandha my nuts hurts? I have no clue, but I know for a fact that it puts a lot of stress on your adrenals. Where do we draw the line on supplements? Well, look at supplements as part of your food intake. That's the way I look at it. So if you are eating specific foods, but you don't eat other access of other foods and you're missing certain nutrients, then sometimes some of these nutrients, they have to come from supplementation. I would not really recommend taking 20 or 30 supplements like certain influencers do. Just take enough supplements that you could be deficient in based on your goal. That's it. Like the only reason I take some of these supplements is because so I can have a longevity factor, but it's mostly for my heart, just because I had an incident 10 years ago. So to me is, whatever I can do to protect my heart, I'm going to take almost every single supplement for it. Very, very simple. So taurine is one of my favorite because it is an anticoagulant. It does improve blood sugar. It does detoxify the body. It does actually has a very strong antioxidant balance. It does actually preserve all the electrolytes for your heart, and it does actually protect your heart from being overstimulated if you love drinking coffee or taking any type of stimulants. So a lot of these things with taurine, actually it is good for the heart overall. It does actually have the potential to lower blood pressure because it allows more magnesium to get into the cells. So you're going to notice that your systolic and diastolic levels are in perfect balance all the time. And it does have the ability to reduce inflammation. So that's one of my favorite supplements that I'll always have on hand for taurine. And if you've noticed, whenever I talk about taurine, people say, well, hey, it's found in energy drinks. Well, the only reason they put it in energy drinks is to actually protect the heart from seizing up. Yeah, that's okay. You can get your potassium from chocolate 100%. The only thing is if you have sensitivity to oxalates, because chocolate does contain a lot of oxalates, then it would be an issue. Matthew, cheers to that. Thank you. When was the last time you've been sick? I haven't been sick for many years. Probably haven't been to the doctor for more than 20 years, but I did have a big incident about 10 years ago. And but I still don't go to the doctor as often at all for anything, for being sick or anything. I just watch what I eat and I kind of continue that way. But the last time I seriously I've been to a doctor for anything that I was sick was probably more than 20 some years ago. How would I know if oxalates are an issue? Well, you'll actually feel it. You'll actually feel that your joints are actually sore, your fingers are actually they're stiff when you wake up in the morning. Some people end up getting like bunion or gout issues. So a lot of these things could happen. Could you do a video on supplement for people with heart issues? What kind of video on supplements? I've done a lot of videos on heart, but explain it. What do you want me to make a video on, Al? I can put it in my notes. I can probably have it done for tomorrow. Because for tomorrow, I wanted to talk about, well, aspirin, but everybody talks about aspirin, but maybe I can do a video on something else, on supplements. Is donating blood healthy? Yeah, it's good if you have high levels of ferritin, iron. So you don't go or check up or blood work, Maurice? No, I do my own checkup on blood work. I kind of book my own appointment and I get the information by email and I read it myself. I never really go to the doctor and actually ask him, hey, explain this to me, because there are clueless. Because the blood work that I get is very, very detailed on specific things that doctors don't know what the hell they are. I've done a lot of video on inflammation, Angel. Specifically for arteries. Specifically for arteries. I've done quite a bit on supplements specifically for arteries. Ow. I've done lots on polyphenols. I've done lots on resveratrol and berberine. Haven't you watched any of them? They told me to take an aspirin when I was pregnant. I never did. Yeah, you don't need to, because they worry about coagulation effect. There's so many videos on heart. I've done lots of videos on heart. Maurice, what do you recommend for longevity? Are there any supplements that really work? There is. You want me to do a video on that, Jackie? I do have about 10 supplements that actually support longevity. These doctors are clueless. My cardiologist is from pharma school. They all support pharma. That's how they make their money. Cheers. Hey, HED. I hope I'm saying your name correctly. Yes. Maurice, what do you recommend for longevity? Okay, let's say we'll do a video on longevity. Okay, I'll do a video on longevity. Can you do supplements in general? Supplement in general? Maybe. So we got 3 requests of videos. I've come across berberine and resveratrol for longevity. I did a video on Ziggy. It became very popular, so I have it pinned. Should definitely check it out. And other than the longevity issue with the berberine and the resveratrol, it does actually work wonders for a lot of people that actually have oxidization of their cholesterol. HD sounds good. Best supplement for hilar hernia. Let me just write this down. Could you please elaborate what lab test do you do beside the lipid panel for anything in specific, or? For hilar hernia, by the way, you can do digestive enzymes, you can do DGL. These would be like my top, and you can do hydrochloric acid after every single meal. These would be ideal, and maybe you can actually have like bone broth on a daily basis. fish oil, vitamin C, D3, multivitamin, taurine, as Maurice I will add. I would never take a multivitamin, to be honest with you. My heart, I take taurine, berberine, merokinase, magnesium, potassium, K2, D3, etc. and niacin. That's a good combination. That's a good combination. That's wonderful. Thank you. We all want to stay as young as we can for as long as possible. Video on longevity. I'm going to put here Jackie requested from YouTube. I will take multivitamin out. I would replace multivitamin with something else. Tap the screen, everybody. Yes, please tap the screen so we can get more people. I don't care so much about the likes, but I care to get more people. We can get more questions going. That would be awesome. This way I can stay a little bit longer, or else I'm going to start falling asleep. ApoA1, ApoB, NMR, LipoA. What about them? Okay, you're missing LPPLA2. You're missing MPO. You're missing OXLDL. You're missing fibrinogen. You're missing homocysteine. You're missing HSCRP. These are actually your numbers we want to look for. One supplement for longevity. NMN. NMN would be ideal. I like NMN actually. I take NMN with nitrate supplement every single morning. What lowers uric acid naturally? This is like the simplest answer I can give you ever. Reduce the intake of fructose. Some of us have a hard time processing fructose to glucose, so you end up causing high levels of uric acid. NMN, nickel, I can't even say it anymore. Nicotinamide mononucleotide. That's what I take every day. Where is it? So this is the one I take by Genetic Labs. I do have it on my website as well too. It comes directly from Australia. So I've been using their product for about a couple months, and I was off for about a month. When I was off for that 1 month, I actually felt a little bit tired, fatigued, didn't feel like waking up in the morning. So I actually felt a huge difference in drop in energy. And you know, I'm a huge fan of energy, of mitochondria. And what better way to boost up your mitochondria than to actually activate your NAD+. Best supplement for peripheral neuropathy or neuropathy, acetyl L-carnitine. The same company as the berberine, right? It is the same company as the berberine. Yes, they make berberine, they make resveratrol, and they make NMN. I actually have all three of them. I have all their three products. I love it. It's one of my favorite. I've tried many companies out there, cheaper companies, but the quality-wise was not even the same, to be honest with you. Best mitochondria builders. So you have NMN, you have creatine, you have D-ribose. Just see where's my D-ribose. I have like a closet full of freaking supplements. It's insane. It's insane. So there's my D-ribose. You don't need no more than about 2.5 milligrams. Tastes good. So D-ribose is the backbone of mitochondria. Keep in mind, everything that happens in your body requires energy. Your mitochondria is what gives your energy, produces the energy. So you need to support the mitochondria. So you have NAD+, which is NMN. You have creatine. You have D-ribose. These are your most crucial to actually maintain a healthy mitochondria. A healthy mitochondria, that means you have energy to think, you have energy to work, you have energy to work out, you have energy to actually digest your food as well. While on the carnivore diet, should I carb backload once a night or once a week? Once a week would be good. That's what I do it. Can you get, now keep in mind, people that actually have heart issue or heart disease, they should do it once a week. People that don't, they can do it daily if they want. Can you get Cavidex as prescription drug in Canada? Not yet. No, you have to actually buy it directly from that website. It's shipped automatically from Australia. And you will get it. I am in Canada as well too, and I got mine. I bought enough for a whole year myself. Let's say we didn't eat clean part of the day. What should we do? Fast 24 hours. Where's the boy? He's sleeping in a tiny house. Let's say we didn't eat mitochondria. What is that? Okay, mitochondria. What is that? So how can I explain this? So think of mitochondria are like tiny structures inside our cells that act like, say, power plants. And these power plants are called like powerhouses. They're what kind of give you the energy production, the cell function, the shape, the structure. So pretty much they're the ones that actually have to support. So there's billions of them in your body, and the moment they're actually destroyed, once your mitochondria levels drops below 20%, you're pretty much expected to have a heart attack. Very simple. So your mitochondria plays a huge role how you actually live. So think of it as your powerhouse in the body. So you want to support them. Everything you do, you always support these mitochondria levels in your system. How much M&M with the creatine and D-ribose? D-ribose 2.5 grams per shot, creatine 5 grams, and NMN you take 2 capsules, which is equivalent to 500 milligrams. You don't need much. What's good for brain health? I'm worried some of my issues have affected the brain health. You have brain health, you have L-theanine. L-theanine works really good for brain health, but I'm testing this new product for brain health got sent to me. It's called, I don't know if anybody has tried it yet. It's called Zembrin. Zembrin. It comes from, Zembrin comes from Africa. They've been using this for thousands of years. I don't know if anybody has ever tried it, so I'm actually trying it right now. MCT oil works amazing, especially if you can get caprylic acid 8. This is my favorite bottle. Caprylic acid 8. This is the one I take. I have it on the website as well. I love this company. They're a huge support. They do really good quality. That's all they focus on, their whole company. They just focus on MCT. It's always good to actually look into companies that actually focuses on a single product, not has like 20, 30, 40 different products. Whenever you see a company that has more than 5 products, skip them and walk away from them. Only look for companies that actually have, a handful, maybe 1, maybe up to like 3 products, and that's it. That means they're doing good quality and they're actually looking after quality than the quantity. What does flushing of the ear mean? Ear turning red and hot. Are you taking anything when that happens? Usually, whenever the ear kind of goes hot and red, it's a sign of blood pressure. Do you think dairy is bad for arteries and heart disease? Only if it's actually pasteurized is bad. Can eat dairy deplete magnesium, especially taken together, because they deplete one another? Yes, because of the calcium. The calcium depletes your magnesium, 100%. So definitely taking extra magnesium would definitely help. So video on longevity, that's what we're actually doing. I don't know if I can have it done by tomorrow, but I'll try. because I like to put out the video before noon. Best magnesium for joint pain. Well, other than you taking magnesium ionic chloride to saturate your body, you can do magnesium chloride gel as well. Works really well. I don't have any videos on that. I don't think so. On the endometriosis, I don't think I have. 3 p.m. Eastern, yes. What would you recommend to improve bone density? You have borax, you have magnesium, glucosamine, chondroitin, you have calcium phosphate as a hydroxyapatite. Correct. Since all milk, all dairy is pasteurized in Canada, that means it's not good. That's why I always say if you actually want to buy cheeses, make sure the cheeses are imported because imported cheeses are unpasteurized and they're raw. Maurice, what was your response on rice water for weight loss? I think that was bullshit. What's your background? What do you mean, what's my background? Like my ethnic. Do you think the choline in eggs yolk can cause issues if having a lot of them? No, if anything, it's going to actually help with anybody that has a fatty liver disease. You can have 20 eggs a day, 24 eggs a day. Nothing to worry about. Education, qualification. TikTok educated. I graduated like last year. Do you guys remember? I think we had a little party here when TikTok gave me a certificate. What's the best thing for mass growth in the brain outside the membrane? That's an interesting question. What's the best thing for mass? I'm going to write this down actually. Never been asked that before. Mass growth in brain outside the membrane. So some type of inflammation that's happening outside the brain. My mother-in-law has mass growth, non-cancerous. Obviously it contains fluid. Now the question is, how the hell did the fluid get there? So obviously there's some kind of leakage. Did they actually take a biopsy of that fluid to see exactly what is it made from? I'd like to know, because based on that fluid, then I can give you probably a treatment for that inflammation. Like we can try DMSO as a gel or magnesium chloride to reduce it. They're sending her in for surgery. Yeah, I'm curious now. Like I know it gotta be some type of free radical issue that's leaking, or it could be something that is leakage. I don't think it's synovial leakage from the bones. So that's tough to say. Like the only thing you can, for a fact, anything that you try as a supplement, because it is a food base, is not gonna actually work as great. Unless we know exactly what it is, so I can give you like a direct access, or maybe we can do like peptides even. He's a clinical nutritionist. Thanks, Al, for putting that out there. Cheers. Maurice is so generous with his knowledge. Thank you, Gia. Is rice good for you? White rice has the least anti-nutrient effect. That's the only reason I eat it once a week. I will call you again. Sounds good, Ziggy. Thank you. Yeah, let me know. Let me know if you can find out. But one of the best thing is to do stuff like that would be phosphatidylserine. They usually come as a liposomal formula, but the thing is you want to put something as external gel to see if that would work, or maybe a peptide. Got an eye floor last week. How can one make it go away? It's your diet that's actually causing that. Sometimes taurine would actually help with that quite a bit because it's a heavy detoxifier. Any good supplement for ADHD? Yeah, L-theanine. L-theanine. You take 200 milligrams morning, lunch, and dinner. Make sure on an empty stomach. No side effect whatsoever. Even kids can actually take that dose. What do you think about air frying any meat? I think air fryer is garbage. It's not stainless steel, it's plastic and Teflon. You're putting poison inside your body. If I was 100% stainless steel, I would say, okay, it's not bad. What do you suggest to eat to gain weight and energy to work out without spiking blood sugar? More meat? I would eat more meat. I got an email. Who's sending me an email that late? Let's see, guys. What the strongest supplement for stress and anger? L-theanine and tyrosine. These would be your top two, Andy. How do you prepare your meat? You're asking the wrong person because I eat the meat mostly raw. So I would actually heat up the frying pan, stainless steel or skillet. I'll put the meat on for like 2-3 seconds, 2-3 seconds. I'll put it in a plate, put some Himalayan salt on top, and that's the way I eat it. Ulcerative colitis. You have probiotics, omega-3s, you have wormwood, you have bromelain, digestive enzymes, hydrochloric acid. How to boost iron levels? Eat a steak. Eat a steak on an iron skillet with some vitamin C. I'm just gonna close this because there's some bugs flying in from outside because of the light. And I gotta take the alarm off or else Duke will go crazy. I'm back. How to boost my iron level? Vegan. Oh, you're vegan. Why are you making it so hard for me, Lala? Do you have to be vegan? Can you please like switch, like maybe like once a week eat a steak, please? Because what happened is a lot of the plant-based and stuff, they might not be as high absorbable, but maybe you can cook some of the plant food in a skillet. I think that would help. Somebody said sea moss, leafy greens. They do carry iron, but it's non-ham iron sometimes. So yeah, you might not be able to increase it. You might always be deficient. I'm trying to think top of my head what else you can use. Supplements for brain aneurysm, nitrate. Hey Zico, how are you? Is nitric oxide good for blood pressure for men? 100% it is. But there's only one specific blood pressure nitrate supplement that works to activate nitric oxide. Not much, how are you? The iron fish. The iron fish, yeah, you can actually do that and maybe make like a plant-based soup and put an iron fish in there. So you can actually get some iron in it. Check it out. You cook with it. I've seen that. Actually, I remember. I've seen it like years ago. I didn't think they still exist, but you just reminded me of it. I eat fish twice a week on plant-based. Yeah, as long as you're eating, you need some kind of, some dense nutrient food. I know the fish does not contain a whole lot, but still it's better than nothing. Niacin, yes or no? Yes. And just make sure, whether you should be taking like TMG so you can methylate correctly. Because niacin will prevent certain methylations for certain people. Will wild Irish sea moss affect any glands? I'm not a huge fan of sea moss, to be honest with you. What about TMG? Try methylglycine to help with the methylation, because when you take niacin, sometimes it prevents the body from methylating correctly. What is your opinion is the best nitric oxide supplement to take? I'm not saying the one I take, but because there is a patent design, and keep in mind, anybody who's over the age of 40 and anybody who has a heart disease cannot actually take just amino acid acetylcholine or arginine because they do not convert to proper nitric oxide. So it has to actually go through the nitric oxide pathway, and the only way you can do that is through beetroot, but beetroot has to be at least 25% extracted with potassium nitrate. Low energy, what to take? Creatine. Why are so many young people getting colon cancer? What helps to prevent it? Think of coagulation. Think of eating fiber. What is fiber made out of? Most of it is like sawdust. So they're actually damaging their colon. They're damaging their intestines. Do you eat mostly raw meat because of your heart? I eat mostly raw meat because it's actually more dense nutrient and you're more satisfied and satiated, but as well it is good for your heart. I barely cook the meat. So today when I had like say 3 eggs, I actually had a couple pieces of garlic with it for the sulfur, and I put some MCT oil, put the meat on the frying pan, like couple seconds on every side, took it out, put it on top of the eggs, and I actually enjoyed it. It was really good. It was super delicious and lots of salt. I probably go about 7 to 10 grams of salt a day. How good or bad is red meat? There's nothing wrong with red meat. Red meat is amazing. Beef is excellent. It's so tasty. I've been eating it every day for 10 years, 2 pounds a day. I don't think I'll ever stop. Any psyllium husk recommend for colon and blood? Look, I would never recommend psyllium seed husk. That's food for horses. If you actually want any type of fiber, look into chicory root. I cannot wait to eat carnivore again. Come on, Ziggy, you can get there slowly. We are working on it. People say it causes cancer. What causes cancer is the stuff you put on the meat, and what causes cancer is the meat that's actually coming from commercialized farmers. Let's just put it that way. Now they want to get you sick, so you stay away from meat and you start eating a printed meat off a printer. What happens when the creatinine is high? Can you still eat meat? Yes, you can still eat meat. And processed meat, it's not good. Yeah, that's 100%. Supplements for gas bloating, please. Digestive enzymes. Do you eat grass-fed meat? I do, yes. Does raw meat have to be grass-fed? It doesn't have to be grass-fed, but if you can get it grass-fed would be ideal. If not, just make sure you get it as lean as possible. Raise your own, 100%. 100%. I would love to. Next year, that's the plan. Next year, I want to have like at least 1 or 2. My 96-year-old grandma has been a carnivore. Grandpa has been a carnivore his whole life. 100%. It's the best way to do it. Can creatine, you mean creatinine? Yes, it could be lowered. What about the individuals who are homozygous with MTHFR, MTRR, and COMT with TMG and methylated B12 be best at lowering blood pressure? That's one of the factor, Matthew. That's one of the factor. TMG, you have methylated B12 and methylfolate will actually control that. But keep in mind, that's one of the factors. The only reason almost 33% of the population, they feel no difference because they actually still are magnesium deficient. High cholesterol is too high. Please advise. Why are you worried about your high cholesterol? Your high cholesterol has nothing to do with heart disease or anything. High cholesterol is just giving you a signal that there's something going on in your body that you should actually start fixing it. What about adding kidney function into the equation? Kidney function like GFR or ACR would be excellent to actually check. I'm subscribing now, brother. What is the best version of magnesium to take with those? You have to take magnesium ionic chloride because it has the highest level of elemental, which is 65%. So that would be like one of your best form to take. But keep in mind, you need a steady supply of magnesium daily. Not taking it once a day, you gotta take it every 4 hours. Do you recommend methylfolate daily for heart disease? Not really, only if you're deficient. Lean conventional meat, where do you get your fats? You have grass-fed butter, you have grass-fed ghee, you have saturated fats, you have suet from, you have beef tallow, you have duck fat, you have lard. So there's so many different fats you can add to the meat. If you cannot afford buying like a grass-fed, grass-finished meat and you're buying conventional meat and you want to add your own fat, you can add your own fat by buying some good quality fat. Like a low functioning kid on a carnivore, like a low functioning a low functioning kidney on a carnivore diet. So if you have a low functioning kidney on a carnivore diet, is that what you mean? You should never have a low functioning kidney, but it was originally started that you will need to take NMN and TMG. Cyanocobalamin, they say that it's actually made from cyanide. I haven't really looked into it much to see, but I should look into it because I've never really been asked that question, but I know it's coming from cyanide. It depends how it's actually, what is it extracted from? How are you cooking your steaks? Sometimes I don't cook them. I just eat them the way they are. I just leave everything room temperature. Like right now, I have my yak meat ground. It's been out since this morning. It'll probably be out all night till tomorrow. Is organic beetroot capsule good to take for inflammation? Not really, no. Waste some money if it's not extracted correctly. You see the new study on B3 and how more than 100 milligram cause damage to the heart? That's bullshit. I did a video about this almost about 3 months ago when the study came out. What are some good supplements for focus? L-theanine, tyrosine. You have, what do you call it? You made me forget the name. I can't remember the name now. Damn, I forgot. 1/3 supplement. Hey Bart, how are you? How is MSM? Do you recommend it? Yeah, MSM works not bad. I like it. You just gotta take about a gram a day for it to actually be functional. It is good to actually mix it with borax and DMSO as a combination. I'm glad I came across this live. I'm so worried about cholesterol. There's nothing to be worried about cholesterol. Only if it's actually being oxidized. But in the meantime, you can take niacin or you can get some of my ebooks on how to control your cholesterol naturally till we figure out why it's actually being that high. Regarding vitamins, how do we know we are taking enough? Any way to calculate properly? You can actually get a status of your vitamins, minerals, amino acids and see exactly what your body requires. But I deal with everything as mega dosing because a lot of the supplementation out there, when they state exactly what's in them or how to take them, they only give you for maintenance level. That's it. I will inbox you. Sounds good. What about mushroom for focus? Yeah, lion's mane is good. Some people like it. Some people believe in it. Some works for them. Some it doesn't. It just varies. After four heart attacks and stroke, I'm going to carnivore on my 63 birthday next week. What do you think? Yeah, why not? Go for it. As long as you actually do it clean, and I don't know whether you have any stents or not, because if you already have existing stents, the saturated fats you consume from the animal products, because they are lipid carriers, they're gonna think that your stent is a foreign issue in your arteries and they're gonna try to attack it. They wanna fix it. It's nothing bad. You just have to kind of be careful not to overconsume too much of it. Because if you overconsume too much of it, you probably could actually have another blockage because the lipids are trying to repair the stent, but they cannot repair a stent. So that's where with the issue we fall into. So we have to kind of be careful of how much we take and what kind of source of fats, of good fats we need to take. I'm currently on losartan, HTZ 100, 25 milligram, Norvas 20 milligrams, and Carapris 0.1 milligrams. Currently 41. Wow, you're very young, man. Matthew, what's the hell's going on? Been on medication since age 16. Essential tremors as well. Currently found out kidney artery issues. Oh, shoot. Okay. Okay, so you're taking a lot of these blood pressure medication. So we have to actually get you off of them. We have to do some further testing to see exactly if we can actually get you off of them or not. Even thought you had a kidney artery damage and stuff. We could actually fix that if there's nothing been done to it yet. Hey Robin, how are you? What do you think about ashwagandha for anxiety? It's okay if you cycle it because it can cause a lot of stress on your adrenals. I heard taking high dose of vitamin D long term can deplete magnesium in the body. Any thoughts? Yeah, only if you're taking 250,000 IU a day for like more than 3 months. Switched to carnivore diet not even 2 weeks ago. What a nice difference it has made with my blood sugar. That's awesome. Excellent, Holly. I'm glad you've done that. Since this found, I did the methylation panel on Detox trying to address the real underlying issue. We can fix the underlying issue. The underlying issue is 100% reversible if you have calcifications in the kidney or artery disease in the kidney. So technically it falls under the category of being possibly soft plaque. The question is, why the hell are you getting soft plaque? And we need to actually address that and reverse it. How to reverse kidney damage? Veggies? No, veggies are bullshit. The only thing is, right now, there is no real answer to actually reverse kidney disease other than 3 of my patients they got it up from stage 4 to stage 2 by doing NMN and TMG. I don't know if it was a fluke or not, but they've been on it for more than 6 months now, and so far it's looking good for them. That it increased. So maybe you can try that and see if that works. Roger that. I appreciate your response. Cheers, Matthew. Keep me updated. Let me know how things are going, or maybe book a time we can actually chat a little bit more. NMN and TMG, yes, they took 500 milligrams of NMN and 1,000 milligrams of TMG every single morning. Did you say cottage cheese, Greek yogurt? Okay, it's not bad. It's not bad. So knowledgeable, would be amazing to have a show like Dr. Oz. I am taking Nefidepin and Nebulong. I gotta look into that. What are they? What are they used for? I haven't heard of that before. There's so many different medical terms. Sometimes I haven't heard of them. I left you a message in your inbox. Please, I'm grateful to you. I'll check it out. Beta blockers. Can you give a shout out to Jenna Talls? Who's Jenna Talls? Is she on the chat with us? Jenna, where are you? Taurine is good in powder or capsule? Powder. We need because they can only fit 500 milligrams per capsule. You need like 3,000 milligrams. Troll. That's okay. Let them come in. They want to have fun once in a while. It's okay. We get a lot of kids sometimes. They come in here and they actually do stuff like that. I guess they're just trying to break a laugh for some of us. I was wondering why my friend has slightly yellow eyes after. Oops. Why, I missed so many questions. If it's powder inside the capsule, but the capsule is so small, it's only 500 milligrams. You're so kind and patient. See, we got him laughing. You are so kind. What is turkey tail good for? I think turkey tail, they're actually using it. It is a mushroom. I believe is mostly for the heart, or was that cordyceps? I have to check. But none of the mushroom stuff, I kind of felt any difference on them. The only one that I actually felt good from was the lion's mane. Not bad. What is good for stigmatism? The correct eyes. You got taurine, astaxanthin, zeaxanthin. Views on GLP-1. You could probably make your own GLP-1. Are you talking about for like weight loss? What to take for high blood pressure? High blood pressure is reversible. I did an ebook on that, Super PT. Check it out. Is eating beans for breakfast okay? No, it's not okay. I would stay away from beans. Why do you want to spike your insulin in the morning and get hit with the phytic acid? Is it normal to have slightly yellowish eyes after 8 months on carnivore? No, it's not normal. There's something going on in the liver. Something's going on in the liver that either the food or the fat they're eating is not being processed correctly, and it's actually accumulating. It could be your bile, your gallbladder is shot somehow. Um, yeah, you need the taurine, astaxanthin, zeaxanthin, and lutein, Ziggy. Would love to check out your ebook for high blood pressure. How do I do it? If you click on my website, on my profile page, on the top left corner is going to take you to my main page. On the main page, there's a website. If you go on that website, then you should be able to access all my ebooks. How are you cooking your eggs? Lightly, very lightly. I just don't want to overcook the yolk. I keep the yolk as raw as possible. I cook the white for sure, but the yolk as raw as possible. Is it healthy to eat 5 eggs every day? I eat like anywhere between 6 to 10 eggs every day. Yes, it is 100% healthy. Nothing wrong with eggs. I don't know why you guys keep getting worried about eggs. 100% Ziggy, we're gonna do that. I'm so impressed. All this knowledge you are pouring out free. Bless you. It's all stuck in my head, so I'm trying to release it for you guys for free. So I hope somebody is has a pen and they're writing all that information down. But if you guys are not, it is all getting pre-recorded on YouTube, so you guys can always go back and watch it all. I add water to the pan and lightly poach. That's a good way. Sometimes what I do, Greg, is I separate actually the yolk from the white. I cook the white because our bodies isn't designed to actually break the white correctly. So sometimes I kind of separate them, cook the white, then actually put the yolk on top and actually just enjoy it that way. But I should try poaching. I haven't tried that yet. There's no high cholesterol in eggs. Dietary cholesterol has nothing to do with increasing your lipid channels, your cholesterol levels. It's totally irrelevant. Whoever is scaring you about it, walk away from them because they are clueless. Dietary cholesterol, when you consume dietary cholesterol, has nothing to do with your high cholesterol numbers. So don't be scared of eating eggs. And in every egg, there's roughly only about 1.5 grams of saturated fat. So if anything is going to increase your cholesterol, that 1 gram of fat, even if you eat 5 eggs, that's 5 grams of fat compared to you eating a steak and you're getting about 30, 40 grams, it's still not going to actually cause a spike in your cholesterol. Whether you actually eat cholesterol or not, your liver still produces 3,000 milligrams of cholesterol. 3,000 milligrams of cholesterol, that's equivalent to 24 eggs a day. So whether you eat dietary cholesterol or not, your liver will still produce cholesterol. What's your take on chelation? Chelation like EDTA for chelation therapy to remove your calcium phosphate from the arterial system. Is that what you mean? I have many stents, but none inserted in the last 7 years. Should I still lower my saturated fats? Mine has been 10 years, and I still kind of have to watch exactly how much I take. I cooked a ribeye and iron skillet, ate with mushrooms today, was yum. Cheers to that, Greg. I'm glad you did. Yeah, the EDTA works good. Chelation therapy, you can take it orally. We've seen some good feedback from oral intake, but keep in mind, a calcified artery, it contains 4 different parts. One part is oxidized lipid, one part is calcium phosphate as hydroxyapatite, one part is protein and debris, okay, and one part is sometimes water and microplastics. So there's about 4 parts to it. So when you're doing your chelation, Matthew, you're taking out the calcium phosphate as hydroxyapatite. That's roughly about 20%. The 40% is mostly your oxidized lipids. That's where Cavadex comes in. That's why I talk very high about Cavadex. Now the other one, the protein and the other debris, that could be removed with neurokinase, serapeptase, vitamin K2, and magnesium. I have the full protocol for each one. I have 3 whey eggs. Do eggs contain bacteria? They do contain bacteria, yes. That's why when I always eat eggs, you gotta make sure you have a good acidity gut. Best coenzyme supplement has to be in ubiquinol form. I ordered some magnesium ionic chloride. Cheers to that. That's awesome. It is bad for digestion. Yes, you should never drink after you eat for about 30 minutes, Greg. How can I do a carnivore diet without high saturated fats? Lean meats? You know, even if it has 5%, 5% is doable. It's okay. It's not gonna hurt you. Familial history of cholesterol. Doctor wants me on statin. All my siblings not on meds. What to do? Who told you you have familial history without doing a proper testing? That's the question. Is carnivore diet okay for someone with high blood pressure? Yes, it is. If anything, is gonna fix it. And blood pressure is fixable too and reversible. How can you clean a gut? Fasting. What is good for diabetes? Type 2 diabetes? Eliminate your sugars. Switch all your sugar, simple carbohydrates to last meal of the day. Guys, we got how much we got? Hold on. Oh shoot. My phone is gonna die. It's like 5%. I'm lucky I caught it. 5%. Guys, we're gonna probably have to call it a night soon. 5%. Let me plug it in before I lose the signal. Okay, we got one phone plugged in. The other phone is at 7%. I haven't charged them because I haven't been doing live because I haven't had signal or power for 2 days because we got hit with a storm and we had a couple of trees fell and knocked off the power lines on the highway, so I lost power. But I have my battery charged, which is good, but I didn't have no internet for 2 days, which is kinda sucks. Good night, Ziggy. We'll definitely chat. Thoughts on ashwagandha? I don't like ashwagandha. Ashwagandha is bullshit, I think. Hi, been 7+ in Canada. It's been cold here, actually. Can you drink water when fasting? Yes, you could. There's no need to do dry fast. Yeah, we had a slight heavy like storm rain, very heavy wind. Couple trees got knocked down. I'm here in BC actually. Restless leg syndrome. What to do? Take magnesium and glycinate. I need to find creative ways to ingest all the supplements other than mixing with water. With your food, sometimes I put all the vitamins in like 1 tablespoon of like meat, all the supplements, and I just take it all at once. Are oats bad? Also good for horses, not for human consumption. Maurice, what's your take on homocysteine? Can that cause those kidney artery issues? Yes, it does. That's why I always look for an optimal level of homocysteine between 7 and 9. And I know everybody says it has to be below 15. I think that's bullshit. It has to be between 7 and 9. I've done so many testing over the years, and that's an ideal number for it. Beautiful weather in Toronto. Must be nice, Angel. Pass me some. I think we're gonna start tomorrow's supposed to be nice, so I can finish some work outside. What if I want to be as strong as a horse? You could. I would highly recommend you eating a lot of digestive enzymes so you can actually break all that fiber. Good night, Grace. Maurice, can a cardiologist check these specific levels? Yeah, once they do the test, they should be able to give you a paper with all your testing, and from there we can kind of customize how much TMG or methylfolate your body required to take. 100%. Nothing's gonna happen in your stent. I have 6 stents myself. I've been on a carnivore diet since day 1 till now. That's 10 years. So, and my cholesterols are in the upper 600 or 7 or 8 if you want to call it in Canada. Nothing to worry as long as you are aware what you're actually consuming. 112 in Arizona, and it's only like 10 degrees here in Canada where I'm at. I eat beef, I eat eggs every day. I eat 2 pounds of beef, I eat about 6 to 10 eggs every day. I eat about an ounce of cheese every single day. So nothing to worry about the saturated fats. It's not gonna cause anything as long as like a clean source of food. Is carnivore bad for people who are underweight? No, it's not, because I heard people lose weight because it does mimic fasting. You just have to increase your caloric intake. Carnivore diet, so you only eat meat? Yes, I only eat meat and eggs and cheeses. Boiled eggs, boiled or sunny side up or mixed with the meat. Did you just say 600 cholesterol LDL? Yes, in the upper 600. Nothing to worry about cholesterol as long as it's not being oxidized. It's all about the oxidization that you have to worry about. Carnivore diet. Can I add you on Facebook? I already followed the business page. Yeah, 100%, Matthew. I don't use Facebook much, but definitely you could, for sure. Will be saturated fat in eggs bad for my stent? No, it wouldn't. It's very, very small amount. It's only a gram. That's not gonna affect you. You need to eat in the upper 100 plus. Then you have to kind of worry. But you don't have eating, well, 10 eggs a day is not gonna hurt you. That's only 10 grams. Very small amount. Human body is so complex. We can survive on only meat or only plants. Well, no, we cannot survive on plants. I don't know who told you that. You can survive on meats, yes, but you cannot survive on only plants because there's no dense nutrients and there's a lot of missing amino acids because it's not a complete amino acid. What is the natural way to fall asleep? Grounding. Do I have problems going to toilet? Do I have problems going to toilet? Who has a problem going to the toilet? Me? I go every day. Why do I have a problem? Because I'm not eating fiber? Fiber is found in our collagen produces fiber. The collagen that is found in meat produces fiber. Can I have 2 eggs a day and not worry about cholesterol? Yes, you can have 10 eggs a day and not worry about cholesterol. But vegans survive. They might not be the healthiest. Vegans are frail. I was a vegan for 10 years before a heart attack. So explain that for me, please. What did you say a good fiber source was to take, please? Chicory root. Are nuts good? Only if they're soaked in water so you can actually release the phytic acid. You guys are making me thirsty. I talk too much. Or maybe too many answers. I was vegan for 7 years because the doctor said, hey, Maurice, you have high cholesterol. You should go vegan and go on statins. And I did that back and forth. And 10 years ago, I had a heart attack. And that's when I actually dropped everything and went fully carnivore. How long you soak nuts for? At least 24 hours. Nuts need to be soaked. Which ones? All of them. All of them, they need to be soaked. Because they all contain phytic acid. If you're gonna eat like a small handful every day or so, it's not bad, but just gonna be careful because you're gonna lose a lot of magnesium. I do have a plaque scan, yes, and the problem is with a plaque scan, after you get a stent, it'll still show high calcifications. Walnuts are okay, they're not bad. If you get them in a shell, like I get them sometimes here from a local friend, in a shell, they're okay. Best supplement to fall asleep, magnesium glycinate, L-theanine, and GABA. I'm making an ebook for best supplement for sleep and how to take them. Only eating meat, eggs, and cheese sounds yummy. It is yummy. I look forward every single day for my food. Like, let me show you one of my... This is what I'm gonna have tomorrow. I keep it room temperature, right? So the more room temperature you keep it, the better it tastes. There's my little ground meat. This is yak meat. It was frozen. So I keep it outside. Room temperature has been outside since this morning, and I'll be outside till tomorrow. That's 24 hours. Then I'm gonna cook it in my little skillet that you see behind me. This is for the one bottom, and the bottom is for Duke. This one here is for me and the skillet. I'll cook it for a couple seconds and I'm good to go. What is the best way to lower triglyceride? Think of triglycerides as a fat storage. The question is, why do you have such a high triglyceride? So what the hell are you eating to actually store so much triglyceride? You're eating too much carbohydrates. Is high protein bad? No, it's not bad. If you're eating like animal products or proper food, nothing processed, the protein is not bad. Maurice, the legend. Hey, Skipman, how are you? Why do I have it up? Yeah, there you go. Now it's reaching better. It's starting to get chilly here. Holy. Need to turn on the heat. Do you have videos that cover thyroid health? So if you have a hypothyroidism, that means your T4 is not converting to T3, or possibly you have at least 20% reverse T3. So it depends on your diet. That is fixable. But in the meantime, you can take tyrosine to actually allow your T4 to release to T3 correctly while you figure out why this is happening. It's very simple fix. But keep in mind, if you leave the thyroid unbalanced all the time, it could increase your calcium levels. Meanwhile, my AC is full blast. Must be nice. Nice and cool with the AC. It's nice and freaking cold here. Have Duke snuggle up. You won't be cold. Oh, he will be. He will come up and snuggle, and actually he'll fall asleep on me like he usually does. His weight will actually keep me nice and warm. He's a big boy. He's heavy. Do you ever eat bacon? I haven't had bacon for a couple years because I'm having a hard time finding pasture-raised bacon. But yeah, I'm a huge fan of bacon because they're so rich in good quality fat. They're mostly monounsaturated fats, and they're actually really, really good for you. So it's the same fat that is found in olive oil that is actually found in bacon. My son has a red rash in both armpits. What could it be? Probably aluminum blockage. He needs to actually detoxify. When you're tired all the time, what's the best supplement to boost one's energy? Creatine. And the question is, why the hell you're tired all the time? It's probably a deficiency in magnesium. Probably as well too, something to do with candida yeast infection. I have never been able to eat pork. How come? Pork is good. Pork tastes really, really well. If you can get some pasture raised. I'm having a hard time finding anybody here that actually can do pasture raised pork. That's why I haven't had it for numerous years. I'm doing your blood test next week. Sounds good. I'm about to go tell the doctor to shove these statins up here. I would do that. What can help with scaries? You can do magnesium gel. It's crazy. A lot of things you say that's good, we are being told in the US that it's bad. It's always like that. They want you to stay sick. How else are they gonna make money off you? Thanks, Maurice. Great night again. Cheers. Have a nice evening. Keep me updated. Will eating nuts like pasta uncooked deplete magnesium? Yes. Depletes magnesium, zinc, and calcium from the phytic acid. My doc told me that creatinine is a bit high. I should reduce salt intake. What do you think? Whenever you have a creatinine a bit high, that goes back to you again because sometimes you could have muscle damage. Or maybe sometimes because you work out or you have any type of muscle mass, it will show that the creatinine is high. Creatinine by itself is irrelevant to look at it. You have to look into your GFR and ACR levels, creatinine to albumin level. See you in the next live feed. Thank you for the knowledge sharing. Good night, Eminem. How to get rid of candida yeast. Send me a message. I'll send you some information. Can't think of the top of my head right now, but there's a protocol you have to actually follow. Most underrated supplement. There's so many. Okay, one last question. We don't use deodorant with aluminum. It started after he was in the river. So something is blocking his what do you call it? I can't remember the exact name. Maybe I'm getting too tired, but something is blocking in his body. I will start to actually detoxify or take him into like a hot sauna. Is that what they call them? Yeah, the sauna or something to actually sweat. Do you like lion's mane? It works on some people and some people it doesn't. Best muscle supplement? Leucine. Adrenals? Something for adrenals? L-theanine would be better, would be good. Thanks so much, Maurice. Maurice, have a great night again. Lymphatic system. Yeah, that's what it was called. The lymphatic system. Whoever was asking that question for the kid, for your kid. So that's what it is. So something's going on with his lymphatic system. There's actually a traditional Asian culture. They do like a massage on the lymphatic systems, your armpits, between your thighs, your shoulder blades, and this will actually help detoxify. See, Matthew's helping me here. I think I'm getting too tired. Hey, Palestine, how are you? Okay, one last question. Seriously, I'm getting tired, guys. One last question and that's it. How can I reduce my creatinine back to normal by drinking a lot of water? Water has nothing to do with your creatinine. Like I said, you want to go back to the doctor and check your ACR levels. Creatinine by itself, it's irrelevant. You guys, there's certain things in the blood work and the biomarkers. Never look at that one thing and question it why so high, because there's certain things that we actually do in combination and in ratios. So once you do your ACR level, your creatinine to albumin, then we can actually find out whether it's an issue or not. Okay, I think that's it. I'm done. I'll come back tomorrow. I'll see if I can come back tomorrow. Good night, Matthew. Good night, Duke. Hey, Blaine. Good night. I hope you're doing good. How's the new pup is keeping you busy? Yes, ACR. Good night, dude. You guys have a nice evening. I'm sure we'll catch up again, hopefully tomorrow, if I'm not too tired. And I'll have to start working on that video that you guys requested for longevity. I'll put it up on YouTube. It'll be a nice long one, and we'll go from there. And hopefully you guys can like it, and we can maybe hit 10,000 subscribers. I'm coming very, very close on YouTube. So you guys be good and have a nice evening. Cheers.